Young people in the state of Idaho are struggling with mental health and with suicide. How do we make our communities the best possible place for kids so that things like substance use, things like mental health challenge are just simply less likely to occur? The cool part about Communities for Youth is that we know prevention is possible. We can make real change in youth mental health just by coming together and talking about it in our communities. When we come together, we see how each of us has sort of a piece to the puzzle. The folks on the Community for Youth team, we really are trained to help facilitate those conversations. We're trained to help identify the right resources at the right time. And we're also trained to look at the data and really help us sort of point the navigation, if you will, in the right direction. Because youth mental health is so overwhelming, it's easy for us to kind of shut it off. So many of our conversations end up with parents going like, I want to help, but I don't even know where to start, and I don't know what to do. I don't know anything about mental health. And then other conversations go, well, we don't have enough mental health care providers, and people just kind of like trail off after that. So often when we try to solve youth mental health, we only think mental health care providers and helping at the individual level. Upstream prevention is an approach that addresses the causes of a problem rather than just treating the symptoms at the individual level. So when we look at prevention at the community level, we're looking to discover what we call risk and protective factors. Risk factors are things that may make mental health issues more likely to occur in a community, such as neighborhood violence or drug use. And protective factors are things that may make mental health issues less likely to occur, like having a trusted, safe adult or strong, deep relationships. So we can actually collect information that allows us to see, in this very community, at this very moment, here is the biggest risk factor, right? Or we can say, here is the thing that is protecting young people from experiencing depression. How, as a community, can we bolster this? How can we bring this protection up? And that's really where Communities for Youth comes in. We help facilitate those conversations. We help make sense of the data that we collect, and we help make it usable right away for communities.